So I'm going to introduce Natalie Jones, who's going to be talking to us first about Victor, a research impact tool co-created by Natalie and now developed into an online platform. So we'll be exploring the practical ways to use Victor to showcase research outcomes effectively and enhance visibility within the profession. And everybody's going to introduce themselves as they go along, as you can do later when it's discussion time. So starting with you, over to you, Nat.
Thanks, Elizabeth, and welcome everybody to the session today. So just to give you a little bit of information about how it's going to go, I'm going to talk first about the Victor tool, and then I've got two fantastic colleagues with me today, Christine and Ian, who are going to give you some examples of how they're using Victor within their research work. So I'm really excited about that. So we're hoping to talk for around 40 minutes and then have an opportunity for you to do some questions at the end. While I'm presenting, feel free to use the chat for discussion and comments and thoughts. I'd really love to hear what you're thinking as we're going along. And if you've got a question, I'd love you to ask, that question in the chat, and then we can pick up on that at the end. So just write question and then what your question is, so it's easy for us to pull out at the end. So, without further ado, let's hear about Victor. So, Victor's an acronym for Making Visible the Impact of Research. So, let's move the slides on the sticky today. So, how this all came about was back in 2017, an advertisement for a secondment to ARC, what was Clark Yorkshire Humber. So that was before the ARCs came into being. And Clark was a collaboration around AHP research funded by the National Institute for Health Research. And they advertised a secondment for someone to come and work on developing a research impact tool which could draw out the impacts of research in clinical settings. And I was lucky enough with a colleague, Judith Halliday, who is R&D manager at Mid Yorks Trust, to get the opportunity to work on developing this tool over a year. And I suppose what drove me to apply for this opportunity was, as a clinician and a manager in the NHS, I was increasingly frustrated at, first of all, trying to get my own research going, but secondly, in the difficulties and the barriers that were existing to convince managers that, research is something that we should be doing as business as usual and not that sort of icing on the cake activity. So that really sort of was my passion and why I wanted to get involved with this work. So today I'm going to introduce you to the Victor tool, and Victor has evolved since it was first published from a pen and paper sort of questionnaire tool to actually now an online platform. And it's the UK's first platform for real-time research impact data collection. And what Victor does is it enables you to capture outcomes from your research, and those outcomes are perspectives on research impact from all different members of the research team, plus patients, carers, and families. And it allows you to curate a brief summary report so that you can make those impacts visible to other people. And it's a great conversation tool. And also, what you get out of it is a nice, uniform, brief summary. So this is a picture of the platform, what it looks like when you go in. There are 4 portals, and I'm going to tell you a bit more about the platform as we go along. I suppose, why is Victor a solution for us as occupational therapists? Well, Victor provides an opportunity for you to track impact, to standardise the way that you evaluate the impact of your research, and it's really something that you can utilise to enhance your and promote your impact, but also your profile within your organisation and wider. And we know how difficult that is. is. We know it's hard to quantify impact. If it was easy, we'd all be doing it. Narratives can get missed, and I think they can be really powerful, those all important stories that can convince people to make change. And also because as a researcher, I know that when you're doing research and it's finished, you're then moving on to the next thing, and you don't always have the time and the resource to spend a lot of time thinking about impact. So this is why I think Victor is a good solution. So I just want to touch on the fact that how we developed Victor was over a year. We developed it with 12 organisations in Yorkshire and Humber, and lots of experts and patient and public involvement and an evidence review helped us really bring together, triangulate a lot of data, help us develop the questions in the tool. So how can Victor help you? Well, what Victor does, it's that capturing of impact data that is both quantitative and qualitative. It can help you curate a visual summary of your impact. So in good old Blue Peter fashion, here's one on the screen that I did earlier. So this is what the Victor summary looks like. You get a front page with your study information on, and then 2 further pages with the domains of impact and your impact stories and information. And obviously you can use that to communicate your impact to other stakeholders. So the Victor questionnaire is based around 6 domains of impact. So health benefits, service and workforce impacts within your team and your service and your organisation, research profile, economic impacts. And what is really interesting about economic impacts is that a lot of studies don't have an element where there is an economic part to it. But by conducting research in clinical teams, there are often lots of investments made that we don't capture. For example, training that's given free to staff. It might be pieces of equipment that are left as a legacy to the department afterwards. And I'm going to give you some other examples of that as well. But, you know, this really helps draw us out those impacts that could remain invisible. Organisational influence and reputation, and knowledge generation and knowledge exchange. So each domain has a number of questions in the tool which draws out the impacts. So who's my target audience for my brief summary impact report? Well, when Victor was first developed, the target audience was primarily for NHS managers and trust boards, executive teams and people like that, because the sort of idea of Victor was that we need to use this as an opportunity to engage around why it's important to research within clinical practice. But I know from using Victor and from others that actually the summary reports have been used for all different audiences and stakeholders. And the beauty of Victor is that once you have the data in the system, you can create as many summary reports as you like for different audiences. So say you wanted to create one that was specific for patients, families and carers, then you would use that the impacts that you would want to specifically speak to that audience about. So yeah, it's quite versatile. So just to talk you through now the flow of Victor and how it works. So once you have access to the online platform, which is free and anybody can have an account, you can set up a project, and in that project you put the information about your project and your logos which pull through into the report. Once you set up your project, you add your participants to that project who might be members of your research team, and they also might be patients, carers and families. So anybody that you want to send out a questionnaire to, you need to add to the project, as well as the people that are going to help you curate the data that comes in. So you're inviting the users to the project. Once you invite people into the project, it automatically sends out a questionnaire to the ones that are designated as a research team member or a patient, family or carer. And they receive that in their email inbox. They open that up and complete it and press submit. And then you receive a notification to say it's come back into the platform, and you can then go in and access the questionnaires and start to curate the data. How you generate the report within Victor is that you're able to look at the questionnaires, and you can filter the questionnaire information through the domains. So say you wanted to look at organisational impact, you can look at every questionnaire in that section, in that domain, and then look at what responses you've got. And then it's a really simple cut and paste of the data into a template which forms the report, which can be edited. And this builds a PDF document behind the scenes, which is then available for you to download or save in the system. And what you do then is you can go in and out as many times as you like, as edit that summary, or create other summaries in there, and you can save that PDF and use it in your communications. So just to show you on the other side of Victor, this is what it looks like. You get an email into your box asking you to complete a questionnaire. Once you have signed up to the project with your name and email address, then you can go in to the platform and the questionnaire is waiting for you to complete. So the users in the Victor project will be one of two, type 1 or type 2. Type 1 people are the research team, basically anybody that has a perspective on impact. So here is an example of service and workforce impacts domain, and a question within that domain is, does anyone have any new clinical skills as a result of the research? And all of the questions are the same in Victor. It's a yes, no, not yet, or not applicable, and then an invitation to provide a narrative response. And it's the narrative responses that really give you those golden nuggets of impact. The type 2 questionnaires are the questionnaires that you would send to patients, families and carers. Now, you don't have to send the type 2 questionnaire. It's totally up to you. This questionnaire only has 3 questions and they're on the screen there. Some people don't use this because they already do the participant in research experience survey within their organisation and they get data from that. But if you wanted to do more specific data to your project, you could also send this out. Obviously, you would need to get the consent of the people involved to add their email and name to the system. So I just now want to quickly tell you about the spread of Victor. So since it was launched into an online platform back in 2023, we've now got 54 organisations across the UK that have Victor accounts, and over 125 researchers and clinicians using Victor as well. And there's quite a broad range of people using Victor. We have obviously Foundation Trusts, Ambulance Service. We have 10 universities that have signed up, primary care organisations. Our first hospice has signed up to use Victor, and they've just used it on a multi-centre trial. And sent out over 130 questionnaires. So I'm really excited to hear about how they're getting on. We've got a couple of public health teams in local authorities, and we've got some research networks. So it's quite diverse, and it's across all sectors. And whether you're doing a small project or a big project, Victor is something that you can use. So our reach is growing. A condensed amount of users within the Yorkshire Humber area, and that's because I was employed for 6 months last year to implement it across the region. So we have 36 organisations in that area, but obviously as more people hear about Victor, they are coming on board, and we've just recruited our first one in Northern Ireland, which I'm very excited about. So, most of the people that responded to a survey that we recently done, and just to say that we had 43 responses, so it wasn't the sum total of the Victor users, said they were early career researchers within the first 5 years of a research career, so that's interesting. And within the Victor, within the 43 people that responded to the recent survey, we got a whole diverse range of people that are using Victor. Obviously, research managers are really interested in this, and people that are leading studies like principal and chief investigators, but also clinical academics and practitioners. So a nice spread. What we found when we did a survey to see how are people using Victor, we've got 4 categories of users currently. So we've got the people that have an account but haven't got a project yet. We've got the people that have got a identified project but haven't used Victor yet, are waiting for maybe the research to finish. And then we've got other people that are actively using the platform and have used it more than once on various projects. So when we asked our Victor users and our community of practice, what are the benefits of using Victor? They said a number of things. They said obviously data collection and gathering impact data is the main reason for use, but also being able to celebrate and highlight achievements within research, or achievements of, for example, fellowship roles where you're undertaking research. A lot of people said it was really helpful for conversations to garner management support and wider involvement of the team or senior people within the organisation, and obviously an ability to demonstrate real world impact. And then some people also talked about Victor allowed them to think about what their next research would be and structuring research going forward. So again, some nice responses. There are so many people using Victor at the moment, and I talk to people every week that have been using it. But here are some of the quotes, and I'm not going to read through them because we are going to make the slides available for you afterwards. But some nice personal impacts that I can talk about, that I've heard about from people that are using Victor that have found it beneficial. So, without further ado, I'm now going to hand over to Christine, and I'll let Christine introduce herself, and then at the end there'll be an opportunity to come back from questions. But I'm really excited that Christine and Ian are going to share with you how they've been using Victor. So over to you, Christine.
Thank you, Nat, and thank you very much for inviting us to share our experiences. So I'm from Leeds Community Healthcare Trust. I'm a physiotherapist by background. I now work in the research department, and we're going to share our experience as very much as an early user. So we're in the early stages of using Victor in our organisation. And next slide, please, Nat. So the study that we've started using it on is a big multi-centre randomised controlled trial. It's a study that's looking at people who've got shoulder pain, and it's our physiotherapy team who are running the study, and I'm the PI for this study. And I thought this would be a great one for us to get started on because it's a big study, and it's comparing the use of a new prognostic tool which helps to talk to the patients about what's expected to happen in their journey, along with physiotherapy, and that's being compared to usual care. As I say, this is a big multi-centre RCT. It's funded by the NIHR, so it's a high quality study, and it's primarily being led by the University of Kiel. Next slide, please, Nat. And the study, as I say, it's multi-centre. It's being run across 16 sites across the whole of the UK. So we're one of those sites. And just to explain as well, it's what's called a cluster randomized trial. So instead of each site having participants randomized to the intervention or to the control treatment, it's actually randomized by site. And we at Leeds Community Healthcare Trust, we got randomized to deliver the intervention. If you want to hear more about the trial, the protocol's already been published, so there's a link there at the bottom. So next slide, please, Nat. So I just thought it would be helpful to talk a little bit about how we got started, and that setting up process. And Nat's already showed you the platform and what it looks like. And just to share that it's really easy to use. So I'm a bit of a digital dinosaur, but even I managed to get it set up. Admittedly, I did do it in conjunction with a colleague at work who's one of our amazing occupational therapists. You might have heard of Vicky Carruthers. So she is on her own research journey, and she's got a PCAF at the moment. And we set up 2 trials on the Victor platform at the same time. I'm just going to share with you about the Panda trial, but she at the same time set up for another study called Triceps, which is being run in their neuro team. Next slide, please. I think the other thing that's really important is, as Nat alluded to, just go back again, is to talk to the study team who are running the trial, if it's an external trial, which it was in our case. So the Panda study, their team, they were really keen for us to use the Victor tool. They were really happy for us to use it. But there were a few things that we just needed to talk with them about, particularly around the timing of when we were going to send out the invitations for people to complete the Victor tool. For the study participants. What we didn't want was to confuse study participants with another request for some data collection, because they were already being asked to fill in questionnaires about their outcomes for the study at 6 months and 12 months. So what we agreed with the Panda team was that we would send out our Victor invitations at that in-between point between the 6 months and 12 months. And we also agreed that we would send out an email from our trust just before the Victor invitation arrived in their inbox, that we would send out an email explaining that this was coming from us in Leeds and not from the Kiel research team that have set up the Panda trial. And that seems to have been working well. So if we can just move on to the next slide. So what have we done so far? We've finished recruitment to the Panda trial now, and in fact, the recruitment's finished nationally now, and we overachieved on our recruitment target. We were set a target of 52. We actually recruited 55, but because we had 4 dropouts, we've ended up with 51 study participants at Leeds. And next slide, please, Nat. So of those 51, 29 have reached that point between the 6-month and the 12-month data collection for the Panda trial. And we've sent out 21 invitations because 8 of those 29 didn't actually have an email address for us to use. So 21 Victor invitations have gone out. And next slide, please, Nat. And we've had 7 completed questionnaires so far. So that's a 30% response rate. We've still got another 22 invitations to send out when they reach that point between the 6-month and the 12-month follow-up data collection. So what did we find? Thanks, Nat. Next slide. So obviously we've not got a lot to share in terms of data at the moment, because we have only got those 7 responses, and I'm not going to go through this in detail. Remember, this is just the questions that went out to study participants. So there's only a few questions that go to them. Next slide, please, Nat. What I did want to highlight was some of the qualitative stuff that comes out when participants are asked to add their comments, as well as the yes/no answers. And as Nat said, I think this is some of the really valuable stuff. So some of the positives that we got back from participants in the trial was that they felt that by taking part in the research, they'd actually been seen a little bit faster than they would have been if they'd been sitting on our normal waiting list. One of the participants felt that they definitely got more information around their shoulder problem than they perhaps would have done normally. And I think what was really interesting for us is that the question around whether or not they would take part in research again based on their experience in this particular trial, we actually got a couple of negative responses to that, which we've never picked up in our participants in research experience surveys. That's the PRES data that all trusts have to collect from participants in their research trials. So that's something that we want to delve into a little bit more in the future and just explore with participants. So next slide, please, Nat. So just really to go through some of the things that we're thinking about now. As I say, we're still very much in the early stages of using Victor. Certainly thinking about the timing of when the Victor invitations go out and the process around that. As I say, we added in an extra email just to explain to participants what was coming their way. I think that's certainly worth thinking about how that's going to work for you in your particular setting and the particular study that you're linking it to. I think we need to give some thought to how to optimise the response rates. I've only shared with you the data that we've collected from study participants. We have actually sent out invitations to the staff that have been involved in the PANDA trial. There are 5 that have been really involved and another 5 that have been sort of involved on the periphery, and we've only actually had 1 response from them. So we need to look at how we increase that response rate. And I think perhaps, again, the timing comes into this. We're going to send it out again once all the data has been collected from the PANDA trial and see if we can collect a few more responses at that stage. And I think the other big thing for us is to think about how we're going to use this data alongside other research data that we're collecting. As I say, one of the things that we're really interested in is those participants who said actually they probably wouldn't take part in research again based on their experience. We want to delve into that, and we're doing some work. In fact, I noticed Zara joined the meeting. So Zara's from our trust, and we're wanting to look at equality and diversity and whether it's certain groups of our population in Leeds who find it more challenging to take part in studies or have a better or worse experience when they do take part in research. So that's something for us to work on. And next slide, please. So our next steps are to do some more follow-up invitations for the PANDA trial to get some more Victor data, both to our staff and also probably longer term to the participants. We've got 2 more studies that have actually been completed that we're thinking that we're probably going to introduce the Victor tool for. Another one's a rehab study, and then there's another, there's a mental health study that we've just got to the end of that we're thinking would be a good one. And as I say, we're thinking about how we integrate this Victor data in our reports that go up to board level, but also in our strategic planning going forwards, how we make research accessible and a good experience for everybody. And I think it's the last slide now, please, next. So in summary, I think the Victor tool is fantastic. It collects something that no other tools collect, and it's really valuable data. But I think what we need to think about is how we optimize the value of that data and what we do with it. And I've just put my contact details there. Very happy to talk to anybody about our experiences and to help anybody else get on board if that's what you want to do.
Fantastic, Christine. Thank you. It's great for me to see how things are progressing as well. And we've got another fantastic example coming up. So I'm going to hand over now to Ian, who will introduce himself, and then we'll take some questions at the end. Over to you, Ian.
Thank you very much. So, hello, my name is Ian Shelton, and I'm an occupational therapist, and I'm from the Pulvertaft Hand Centre, and it is in Derby. And I was the principal investigator at Derby in a multi-centred RCT, and this was called FIRST. After this sort of was going on towards the end, subsequently I received a grant, and this was from my professional association, the British Association of Hand Therapy, to measure the impact of the RCT using the Victor tool, hence iFirst. Next. So a bit about the background. The Flexor Injury Rehabilitation Sprint Trial, or FIRST, this was an NIHR funded randomized controlled trial, and what it did is it compared the 3 splints that we commonly use in flexor tendon rehabilitation. We did this over 26 hand therapy sites across the UK, And for many of and this was a therapy run trial as well, so we really encouraged, the chief investigator really encouraged therapists to be involved with this. For them, it was their first time being principal investigators, associate principal investigators, actually therapists getting involved with research, and especially in a large multi-centered RCT. So we thought first provided a valuable chance to measure the impact of research participation, of course, on that clinical practice, the research capacity, and especially in these hand therapy teams and the wider areas that research reaches. Next. So to evaluate it, we used a mixed method approach, and we did an online survey, and this was sent to all first trial delegates. And then we also conducted semi-structured interviews, one for each site, with a range of roles represented. So not just therapists, we tried to get those other research nurses, surgeons, tried to grab those into it. The reason we used the Victor Research Impact Tool, because it was specifically designed to measure organisational outputs. We know it had been research backed, and we know it had been used in a previous RCT, which we'd spoke to the author about the research and looked at their subsequent paper about it. So ultimately, we felt it gave us a solid framework to work from. Now, personally, we were one of those people that didn't use the Victor E platform. Instead, we built our own on Qualitrix, and this allowed us to adapt the questions for first. We also made this decision because of our clinical trials unit being the same as the one we were kind of using with first. And at the time, we felt a bit more like we had control of our data, and we could use our already, delegation log and the contact details of those staff. So that was the reason why we did that. Next. So we had a very healthy response rate with 103 completed online surveys out of 342 from the delegation log. And we managed 25 interviews out of 26, so a lot of data. The respondents, they generally reported health benefits. They've got more evidence-based, clinically released and personalised care. Safety and governance, that was felt to be enhanced by the rigorous RCT protocols. At service and workforce level, they described implementing new splinting practices, again, updating guidelines and shifting towards the more patient-centred care. And the overall positivity for the research skills, the confidence, it was kind of overwhelming from these people. Themes also came about the reluctance once the trial had finished to implement until proper results were kind of going to be published. So these therapists, or therapists in general, tend to be a reluctant bunch, it would seem at times. And then it was also able to capture the burden of research. So the strain that it kind of sometimes put on that work-life balance, particularly lots of kind of themes and comments came around having time to engage in research and not having this necessarily protected, budgeted for, etc. Next. So we felt that Victor enabled impact to be effectively measured with the benefits seen over the 6 domains. It aids with transparency of data collection and that extraction, and it also allows those kind of hidden areas to be explored. And with its continued use, hopefully it can only strengthen its application. Reflecting on it, especially for the use that we're doing it for, we felt it was very deductive. So within that framework, it maybe didn't allow some responses to be factored in. So in the ways that some of the research areas may have been, time consuming, but that was where the anything else kind of section came in, which I think really kind of helped with it. Future plans, hopefully we might do this again because we've measured impact maybe just as the RCT was finishing, and we've got that impact there, and we might try and do it in another stages, maybe 2 years down the line, because I think it's really important that we've got a snapshot of the impact now, but further down the line, I think it'd be really important to see. Next. And then I thought, reflecting on the whole experience. So again, I think for therapists to be involved in being a PI, APIs, I think it's absolutely fantastic. And I echo Natalie's comments about the Victor tool being there to hopefully capture that. And it was really nice to see from the Victor tool how these therapists grew, how they really valued research, how it was the first time they got involved with it. And I'm really looking forward to getting through all this data and then getting published by the end of the year, hopefully, and sharing it. Thank you very much.
Thank you, Ian. That's fantastic. So I just want to finish off by sharing a little bit more about how I've used Victor from a personal perspective. So my study was breakfast group interventions in stroke rehabilitation, and I used Victor immediately after the study had completed. And at that time, the platform didn't exist, so I used the pen and paper version. And then I sent Victor out about 18 months after the study had closed. And what was really interesting was that I heard about lots of impacts that had happened in that time that I had absolutely no idea about, because I wasn't working in the organisations, well, two of the organisations where the research took place. So that was fascinating for me, and I'll tell you a little bit more about that as we go through. But just to give you some ideas about how I've used the impact summary for Victor. So what was really helpful for me as a researcher was that understanding the impacts of the study helped me get some ideas around the effectiveness of the intervention that I was testing out feasibility and acceptability for. And it was a really rich amount of data that I got, so that I was able to tell some really powerful stories. And in that, I used those stories to secure further funding and grants. So I got a postdoctoral fellowship on the back of some of the information I was able to provide in my application through Victor. And then I've also used the summary with other people nationally. So I was invited to take part in the Royal College of Physicians review of the stroke guidance, and I joined the topic group for nutrition and hydration, and it was really great to have conversations nationally with colleagues about the impact of my study and try to influence around future conversations around how we should be doing more of these types of interventions in practice. And then it was great to have, if you like, the golden nuggets that I was able to communicate in social media, and the local newspapers picked up the impact of the study. So it was great to have that available. It also enabled me to set future priorities for my own research, understanding what the impact of this study had been, and also that conversational tools to engage with key stakeholders. And just one of the nuggets that came out of the 18-month review was that one of the organisations that had taken part in the study, their organisation and their patient facing teams really embraced the idea of breakfast group interventions and got more involved with understanding the lived experience of stroke survivors. And as a result of that, the organisation did a Ban the Beaker campaign across the whole organisation and removed beakers from drinks trolleys. And they also funded more dignity crockery and adaptive cutlery, which was an actual significant economic benefit that had come as a result of the study, a catalyst, if you like. And this is what we know as researchers, is there's very often some, if you like, things are spawned out of research that actually make a real difference to patient care. But if you're not capturing them, they do remain invisible. And lastly, obviously, there was lots of people involved in my study. I had 3 sites and I had 3 PIs, and they went on to do open up as first-time PIs, all 3 of them OTs. I'm proud to say they all went on to open up more studies, get more involved in research, get internships. So Victor enabled me to capture that data as well, that capacity building data. So what's next for Victor? Well, as you've heard from Ian, some people use the platform and some people don't. I would like to refresh the tool because since 2017, a lot of things have changed in the world, and I think there are elements of Victor that I want to update and refresh, and I'd love to have the function where people can add in their own questions as well in the future. For now, it's a set questionnaire, and that's why colleagues such as Ian and other colleagues around the country have chosen not to use the platform, have chosen to use the framework and some of the questions, but add in their own, and that can be done as long as you credit the source material. I want to build a community of practice around Victor nationally, and I'm currently employed a few hours a week by ARC Yorkshire Humber to do just that. And there's lots of things that I want to do in terms of developing another version of Victor that captures research impact, capacity building data, and really continue the scale and implementation. And I'm currently looking to where I can get some further funding for research and innovation to develop Victor further. And I'm also really excited about the possibilities of using AI in Victor. So if you want to get in touch, and you would like access to Victor, what I'm probably going to do is organise some group sessions where people can come along in groups and get a show and tell session to find out more, and you can email me if you'd like to find out more about that. So we've got about 15 minutes left, and I'd love to have some questions and hear what you've been saying in the chat. So I'm going to stop sharing the presentation. Thank you for listening, and thank you for joining us today, and big thank you to Christine and Ian as well.